Good morning. I'm Gregory Moorhead, and I'm the Director of Student Disability Services. You're in the right session. I'm going to start off talking about disability services very briefly, and I'll talk about our mission statement and talk about what students need to do in order to request accommodations here at the University of Chicago. So let me start off with reading the mission statement, which reads like this. The University of Chicago is committed to ensuring the full participation of all students in its programs and activities. Campus and student life, of which Student Disability Services is a part, complies with Section 504 of the Rehabilitation Act and the Americans with Disabilities Act. If your student has a documented disability or thinks he may have a disability and, as a result, need a reasonable accommodation to participate in class, complete course requirements, or benefit from any of the university's programs or services, he should contact our office as soon as possible. I would like to add there that our office is also responsible for providing accommodations for students with injuries. So if your student sustains an injury, he or she should contact our office as well. To receive any academic accommodation, your student must be appropriately registered with Student Disability Services. Because requesting accommodations and the approval process is lengthy, we really encourage students to start the process as soon as possible. It's actually a four-step process. I'm going to go through that with you right now. This will be the last piece of my presentation. The first step is for the students to contact Student Disability Services so that we can discuss the diagnosis and determine what kinds of documentation would be needed to support their request for accommodations. The student would then provide the required documentation to Student Disability Services. Then the third step would be that our office would review the documentation and determine if any reasonable accommodations will be appropriate, and then finally how to implement those accommodations. Then the fourth step would be our office would provide the student with a letter of accommodation. The letter of accommodation spells out the accommodations for which the student has been approved, and that letter the student shares with faculty and their advisor. Finally, any student or faculty or parents, if you have questions or concerns about Student Disability Services, please feel free to contact us. This is our contact information right there, the phone number, and our website address is disabilities.uchicago.edu. Thank you so much.
I am Alex Lickerman. I am the Assistant Vice President for Student Health and Counseling Services at the University of Chicago, and I'm going to tell you guys today a little bit about Student Health and Counseling Services, about what we do, how to access us, and then at the end we're going to talk about insurance, and then after that take your questions. So I want to put up our mission statement because we actually formed this statement from feedback we received over the years from students. And just to take a minute to read it, our mission really is to provide University of Chicago students with excellent, comprehensive, student-centered care and health promotion that includes superior customer service, superior student education, and superior access to programs and services. We were very deliberate when we crafted this statement because of the feedback we've gotten from students. You know, in terms of the clinical care we provide, meaning when your student is in the room with one of our providers, we really feel that has been and will continue to be the very highest in the country, if not in the world. But the customer service that goes on around that, sort of how easy it is to make appointments, how easy it is to get in and see us, how clear our directions are, all the things that follow that appointment, we've been working very hard the last few years to improve. And so we thought it was so important, the students told us it was so important, that we made it a part of our mission. We also view part of our mission as student education, and not just education about how to use our services or about how to be healthy and continue to maintain their health, but also ultimately how to use the American healthcare system. If you think our system is difficult to use, those of you who've used the American healthcare system know it's many times more difficult. And then finally, access. Access. This has been, year after year, one of the most important points the students have raised, being able to get in to see us when they need to see us. So we worked very hard to make that best in the nation, and so I'm going to talk to you a little bit about what our service standards are in a minute. Just real quickly, these are our values. Not that we don't value other things as well, but when we sort of identify ourselves, the values that we try to exhibit every day, it's these. And though it is number 6 on the list, it is not number 6 in our thinking, and that is confidentiality. Again, students have told us again and again how important that is to them, and I just want to stress that we take their confidentiality very seriously. Okay, where are we? So this is a map of the campus, and there should be maps on the table out there which you're free to take on your way out. But we are composed of 3 divisions. There's Student Health Service, which is the name for the part of our division that handles medical care. The Student Counseling Service handles mental health care. And then Health Promotion and Wellness exists to promote healthy behaviors and provide programming on campus, not in a non-appointment-based manner. So you can see where the H is in the blue building there. That's the actual hospital. That's entered on 59th Street, which is the horizontal street below the bottom of the map. There is a security officer at the front desk who can direct your student to our health services, which is really right near that entrance. Very easy to find if you come into the hospital that way. The Student Counseling Service, as you can see, is on University Avenue, the C. It's in a house, and it is unfortunately next to a fraternity. But they make there's peace between them. And then the Health Promotion and Wellness space used to be in the administration building, but actually in 1 week they're moving to the South Campus down here in the Woodlawn building. They're going to actually have programming space for the first time, a big room where they can do lots of health promotion programming, which I'm going to talk about in a minute. And then finally, right on campus in the DCAM building, up at the upper left corner of the map, that stands for the Duchossois Center for Advanced Medicine. That's the university's outpatient building. On the first floor is a pharmacy there that is extremely convenient, and students are able to fill prescriptions there if they want to. I should mention also, just one second, there are a number of other pharmacies in Hyde Park. There's a CVS, there are Walgreens, there's another one called Catsaros, and students are able to fill their prescriptions anywhere they want. If you could just hold on your questions till the end, that'd be great. Happy to take them then. All right, tell you a little bit about our patients and number of visits. Just to give you an idea, there are 15,000 students attending the University of Chicago. Only 12,000 of them, however, are able to access our services because only 12,000 of them pay the student life fee. That is 3,000, they're like PhD students who are maybe off campus, not actually on campus. But if you're enrolled as an undergraduate, you are required to pay the student life fee, therefore access to our services is paid for. And in the Student Counseling Service, on the left side of the chart there, you can see that last year we saw about 13,000 visits, about 1,300 of which were daytime emergencies, and about 250 of which were evening or weekend emergencies. On the right side of the slide, you see student health service utilization. At the bottom, where you see total visits, about 21,000 visits. So the first thing you notice is that in the student health service, we have about double the number of visits. That's because the nature of the complaints that students come to us are very different. And on the health service side, we see patients in 20-minute blocks, which is typically sufficient. On the counseling service side, each visit is an hour. All right, tell you a little bit about student counseling service. So here's the profile of who works there. We have 7 psychiatrists, 6 social workers, 8 psychologists and 4 administrators. FTE, for those of you who don't know, stands for full-time equivalent. And the reason those numbers are less than the number of people is because most of the people in counseling are part-time. This is a flyer that is around in the counseling center and the health service center. This is an advertisement to students who use our services. We have piloted for the first time last year, and we'll be continuing now from now on, a patient satisfaction survey. And I'm going to show you an example of what that looks like, but we really want to hear from your students about their experience in our services. A lot of the changes we have made are as a result of feedback we've gotten from surveys like this. We certainly like to know that we're doing well, but when we're not doing well, we want to hear in what way specifically. We take that feedback very seriously. And so here, in fact, is an example of the data from last year for the counseling service. You can see some of the questions that are there. And on the right-hand part of the slide, the green numbers show the percentages of students who are either satisfied or very satisfied with our services. Now, I put this up not to sort of pat ourselves in the back and tell you we think we're doing a great job, but to tell you this is sort of the baseline data that we've accumulated. And over the summer, we had a retreat where we basically sort of sat down and decided that our targets going forward are going to be to have all students, 95% of students that is, be either satisfied or very satisfied with our services. And so this is a way we're going to continually monitor that. So if we find ourselves starting to sink down, we're going to ask ourselves, why is that? And want to leap to react to that and adjust. Okay. So what do we give you in student counseling services? The first thing is there's no waiting list. And I put this up here because, again, access seems to be the most important thing to students. And as far as I know, we are the only school in the country whose counseling service does not have a waiting list. What do I mean by that? When a student calls up the student counseling service to tell them that they have a mental health problem, there is no list of students waiting in line to be seen, so that once that person who's talking with the student understands the nature of the issue, they will make them an appointment usually within about a week. But if that student says to that counselor, you know, I really just can't wait, I am really in distress, that person's going to say, why don't you come right in now? We're going to see you now. We also have 24-hour, 7-day-a-week emergency call, and it's actually a two-tiered system. The first level of call is usually a psychologist or a social worker, backed up by a psychiatrist. So in case there are medication issues or just the first-line call person needs to run the case past the psychiatrist, and that psychiatrist is then backed up by the counseling director himself, Dave Albert, who was here for the first morning session but had to leave to go to another presentation. So what do we do in counseling? We offer diagnostic services, brief psychotherapy, and referral services. So this is kind of important. The goal of the counseling service is to get students back on their feet so that they can experience academic success and personal success. When the student comes in for that first appointment, that intake appointment, where we're assessing what is the issue, if at that point the counselor assesses that this issue is going to require long-term therapy, in order for us to maintain that no wait list, we are not able to provide long-term therapy, and so we will refer the student out to one of our community mental health care providers, at which point those visits will be billed to that student's insurance. If, however, the initial intake suggests that that student's problem is something that is going to be addressable in short-term or even medium-term therapy, we will keep them in the counseling center, and our counselors, one of them, will start working with your student. There is no visit limit, no hard and fast limit. This is a myth that persists on the campus, and we're trying to dispel this. It's not we say you get 10 visits in counseling, and no matter where you are or what's going on, at that point we refer you out. That is not true. Certainly, if we miscalculate, it ends up that you need to be seen longer than we thought. If it's a little bit longer, we'll keep you. If other issues come up during therapy and we think that it's going to require really long-term therapy, at that point you will get referred out. We obviously prefer to see students in the counseling center ourselves, not just because we think our counselors are outstanding, but because insurance companies won't be billed for it. But in order to maintain the no wait list, which we think is one of the most important services we provide, we're not able to do long-term therapy. We offer individual and couples therapy as well as group therapy. And then medication management. This is a really nice thing. We are one of the few health services in the country that has a large bevy of psychiatrists on staff. And psychiatrists actually can manage the medications of your students without referring out. And what do I mean by that? You know, medication management or medications for mental illnesses have become so effective for certain mental illnesses that there are students now coming to college and actually succeeded in college who in days gone by never could do it. You know, students who have bipolar disorder, even schizophrenia, people who are seriously mentally ill are maintained on medications, but those medications often need management, meaning monitoring, dose adjustments, sometimes lab tests need to be checked periodically. Our psychiatrists will provide that to your student ongoing for free. We're not going to refer out for that, so that's a really nice benefit we offer. Let's Talk is our version of Lucy and Charlie Brown. You know how Lucy had the psychiatrist in, little thing set up, and Charlie Brown would come by. We recognize that even in 2013 that there is a stigma associated with seeking help in a mental health setting, and we are thinking very hard about how can we reduce that barrier to entry to our system so that students who are in distress can get our services. And one of the strategies we use is what's called our Let's Talk program. So around the campus, right now in 3 locations, but there may be some plans to enlarge that in the future, we have members of our staff who just hang out for an afternoon or so, and any student for any reason can come anonymously, sit down, and just start talking. And in fact, we know this program is highly successful because a number of students who ultimately end up coming to the counseling center to get therapy come through the Let's Talk program. And then finally, we have an academic skills assessment program where if your student is struggling, say with procrastination or even a potential learning disability, we have programs where we can actually help them so they can be successful academically. Okay, I'm going to switch gears now and talk about student health. Here you see that our administrative support staff, it says 5 people with 6 FTE. That's actually impossible. That slide is wrong. We actually have 6 positions, and we just filled one just last week. So now we have 6 administrative support staff. Clinician support staff, we actually have 8. We have 6 nurses, 1 lab tech, and then 1 medical assistant who we just hired as well. And we have 11 direct care providers, slightly more than 3 of whom are nurse practitioners and 3 of whom are physicians. And then we have specialists. We actually have a musculoskeletal specialist who does work in the clinic itself as well. Here are the results of our satisfaction survey data. And again, you can see some of the questions and the domains in which we're asking. And then also on the right, the percentage of students are either satisfied or very satisfied. Again, Not to pat ourselves on the back, but to tell you this is where our baseline is, and our goal is to be consistently above 95% in all of those domains. Okay, so what services do we offer? So certainly, we take care of acute and chronic medical conditions. So whether you sprain your ankle playing ultimate frisbee, or you have asthma or diabetes, hypertension, whatever, we will take care of you. We have an after-hours nurse advice line, so when we're closed or on weekends when we're not available, you can call and have your complaint triaged, meaning they can determine the level of severity of your issue and either give you advice or tell you that you need to go to the emergency room, or you can wait to make an appointment on Monday. We have an acute appointment service standard. By that I mean, our clinic is different from most primary care practices in that in most primary care practices, most appointments are actually return appointments. So, patients have chronic medical conditions, or, they're being scheduled out every 3 or 6 months. Our students mostly don't have chronic medical conditions. They have acute problems. And so most of our visits are acute, though we certainly, as I said, will do return appointments for students who have chronic medical conditions. We can manage those as your student's primary care provider. But our service standard is if a student becomes ill, hurts themselves, whatever, and calls us, our goal is to get them in within 24 hours. And in fact, most of the time we can do it even sooner than that. If they call in the morning, mostly we can get them in the afternoon. If they call in the afternoon, mostly we can get them in the next morning. The challenge that we have had is that though we can offer those appointments, many times the students turn them down. And they turn them down because they have class or they're busy in some other way. It's not convenient for them. And so we recognize that's an issue, and we have instituted a new process to try to increase our flexibility for students, and that is the second to last bullet point, which are walk-ins. So I want to be clear, we discourage people from walking into our clinic without calling first. It does happen, and I should say when that does happen, we will always have a nurse come and triage that student. But sometimes if that student's there with a cold and we don't have any appointments that day, if they come in, say at the end of the day, we'll tell them they have to make an appointment to come back the next day. But if you call and you say, it's say 8 o'clock in the morning, and you say, I have this cold, or I'm feeling sick, I want to come in and be seen, and we tell you we have an appointment for you at 2 o'clock, and you say, well, I have class that is not convenient for me, the student will be told we also have walk-ins. That is, we reserve a certain number of slots every day, and as long as those slots are available, we will tell the student, you can take that 2 o'clock appointment, or you can walk in now. The only disadvantage of walking in now is that it is first come, first served, so you may wait a long time. So we piloted this last year. It actually was quite successful. A number of students did use it and liked it very much, and it's just our way of trying to improve our flexibility so that we can not only meet our service standard of offering appointments within 24 hours, but actually students getting appointments within 24 hours, or at least being happy to accept those appointments. The third bullet point, medical triage, we now have a nurse on the line, so when students call, it's not just a coordinator with no clinical training who's answering the phone. Often it is a clinical coordinator, but if there's a medical issue that the student wants advice right away, the clinical coordinator will hand the phone to that nurse, who can then actually use her clinical training to triage the student appropriately. And then finally, for the first time ever, we are now going to be offering Saturday hours. In other presentations, in other settings, when I give this presentation, the students admit it, there's been applause at that announcement. We are able to do this because we figured out a way to fit one more provider into our current clinical space than we have ever had before, and that opened up a world of possibility to have Saturday hours. So the Saturday hours will be in our same clinic space. It'll be from 9 to 1 on Saturday. There'll be one provider and the support staff there, and we're rolling it out just this month, and or actually I think October 1st. We're expecting the students to really appreciate that. Okay, lastly, I want to talk about student health promotion and wellness. So health promotion and wellness is the division that is here to create programming to keep your students healthy. And there are 2 administrators, there are 4 health educators, professional health educators, 1 project manager, and then 14 student health advocates, we're calling them. So the mission, I'm putting up the mission statement of health promotion and wellness because they're not entirely parallel to health services and counseling services, but it is to build the resilience of our diverse campus community by empowering students to navigate healthy lifestyle choices that foster academic achievement, holistic health, personal discovery, and lifelong excellence. The basic idea is health promotion and wellness exists, to promote healthy behaviors in students that decreases the risk and liability so that they have an increased likelihood of academic success. So here is a list, a short list of the programming that Health Promotion and Wellness offers. And I should tell you that the Director of Health Promotion and Wellness once brought me an orange binder that was literally this thick of all the programming that she has developed in just the last year to 2 years. As an example, the first thing is something called Pet Love, where, believe it or not, different people in the campus community will actually bring their dogs in to have students pet them. So you think your student doesn't really care about this? Your student wants to pet the dogs. I know this because 1,000 students, we counted, 1,000 students lined up last year to pet the dogs. It's one of our most popular events. And someone from the previous session asked if that includes cats. It does not. Yoga is offered. Stress Busters is a program began out east where students are taught to give clinically appropriate massages to other students. That's a very popular program. Some of the large-scale events that are offered, there is Wellness Week and Wellapalooza. It's a week-long series of programs designed to encourage and educate students to follow healthy behaviors. Uncommon Nights is alternative programming. It's a social event that is alternative to other alcohol promoted events, I should say, other events where alcohol is served. And it turns out we know almost 50% of our students are looking for social programming that does not include alcohol. And so this is a really nice thing we're able to offer them. And then the flu program, the flu season is about to begin around January. We have every year at this time a huge drive to vaccinate the university, including students. The vaccinations are free. We strongly encourage you to encourage your student to come and get vaccinated. They can come either to the Student Health Service or we're going to have different clinics announced that'll be all around campus at different areas. So many opportunities to get your flu shot. Health Promotion and Wellness also does some general and customized workshops. They have workshops on body image, including issues around eating disorders, alcohol and other drugs, issues around sleep, stress management, and then Be Wise, Be Well is an example. It's a 9-course lecture series on topics related to health. And then there is this, the Resilience Project. So the Resilience Project is a project that began last year based actually on a book that I wrote that is called The Undefeated Mind. And the idea is that research is now showing that resilience is not something that you are either lucky enough to be born with or unlucky enough to be born without, but something that everyone can actually take very specific steps to increase within themselves. The research is now showing that. And so we took a lot of the research that I used to write the book and we developed it into a series of workshops that we piloted last year with 14 undergraduates. It was a series of 9 workshops, 3 per quarter, and we actually measured on standardized scales in the psychological literature their resilience before and after the intervention. And what we discovered was that it seemed actually to work, that on average the resilience of the class did increase in specific ways. Now, this was a pilot project. It wasn't designed to detect that difference yet. It was really designed to teach us how to deliver this material. And so now this year we're expanding this to 80 students and are actually actively recruiting now. Spots are filling up fast, but if you think your student might be interested, please take a look on our website, on the Health Promotion website, and ask them to contact the link there, and we can get them involved. Okay, I'm going to pause now and turn it over to Shay Hubbard, who is a representative from United Health Insurance, to talk a little bit about our insurance. And then Marcy Hochberg is going to talk about dental and vision plans, and then at the end I'll stand back up and take your questions about anything you've heard so far today. Thank you.
Good morning. My name is Shay Hubbard, and I'm one of the on-campus coordinators for United Healthcare. The school does actually host 2 campus coordinators, myself and Sue Williams. All students every year are automatically enrolled in the student health plan. You have the deadline, October 25th, which is a very important date, which Marcy will stress again, but it's a very important date to either enroll in the student health plan, waive the student health plan, or add dependents. After that particular date, you will, the student insurance fees will remain on the bill, and the students will actually have the insurance plan offered by the university. It's a very robust plan. There is a $200 in-network deductible. There is an out-of-pocket of $1,500, which does include that deductible. After that point, once the $1,500 is paid out by the student, the benefits will pay at 100%. There is an unlimited for prescription benefits. Again, that's DCAM, or you can go to CVS, Walgreens, any pharmacy to pick up prescriptions. Another thing to access the UChip plan to remember is that The student life fee does cover for the student to receive treatment, acute care within the student care center. But if there is a need for any type of x-rays, ultrasounds, certain type of lab work, that's where the UChip plan would kick in and cover your student. In order to receive outside care to any physician office visits, the student care center will provide the student with a referral. The referral is for the condition and not for a particular provider. The referral is good for as long as they have the plan through University of Chicago. The student does not consistently need to go back for the same condition. If there is no referral in place, for each date of service, there will be a $50 non-referral penalty that will be attached to the bill. These are the prices that's for the student health plan. They are billed on the tuition bill, and it is billed in the autumn, winter, and the spring. Summer is included. The plan year goes from September 1st until August 31st, so even if your student is not taking classes, they will consistently have coverage over the summer, and the plan will follow them home, so it's not just for the state of Illinois. In addition, if your student does waive off October 25th, just to keep it in mind, if your plan terminates, you can add the student onto the plan. If the student takes the plan now and maybe during the year has a new job and it may offer them insurance, the student can waive off. So this school does have certain instances where they will consider if you can stay on plan or if you can waive the plan. One way to access the plan, we're no longer sending out the cards by mail. We're giving the students the access to go ahead and create a My Account and print a card that they can take with them to the physician's office visits and for pharmacy visits. And that's by creating a My Account. And as I stated also, there are 2 on-campus representatives that's able to help your students navigate through claims, any type of prescription coverages, or anything they have questions about as far as their benefits, help with finding providers in the area. Sue and myself will definitely walk your students through it. We're eventually going to move to the 61st and Woodline building, but currently this week we will still be in the administrative buildings between the hours of 8:30 and 5 for any questions if the parents want to come by and talk with us. Again, that's the My Account that I talked about earlier. You can definitely check your claim status, find pharmacy providers. You can also download the cards. All of that is available on the My Account for the students. And then I'm going to hand this over to Marcy to discuss about the optional dental and vision plans, both offered by United Healthcare and Delta Dental.
Good morning. I'm Marcy Hochberg, the Student Health Insurance Coordinator at the University of Chicago. So let me just clarify, we do host 2 on-campus insurance representatives who work for United Healthcare Student Resources. They are here to help you understand the details of the university student health insurance plan, which we conveniently refer to as UChip. You'll get to know a lot of acronyms here at the University of Chicago. But I am here to help your students understand just insurance in general, navigating the insurance process, and if they run into any difficulties navigating anything related to the UChip plan or even their own student insurance, I'm here to serve as an advocate for them. So just to clarify the different roles, now that you have a sense of who I am, I just want to talk a bit about our optional dental and vision plans. But before I move on to that, just very quickly, how many of you are planning to have your students stay on your own insurance plan? Okay, so I just want to revisit a point that Shay made at the beginning of her presentation and just remind you, we do automatically enroll your student in the university student insurance plan. If your student is planning on staying in your insurance, what they are going to have to do is waive out of their enrollment in the university plan, and they need to do this by no later than 5 p.m. on Friday, October 25th. So just indulge me for a moment. Everyone say with me, Friday, October 25th. Now, I'm making this point to you because I'm assuming you all are the bill players here. And if your student does not waive their enrollment And if they're over 18, they're the one who has to go online and do this. But if they have not waived their enrollment by Friday, October 25th, you're going to get billed twice. So make sure this date is forged in your memory, and you can make sure your student has taken this step. They need to go online to studentinsurance.uchicago.edu. You may have seen our little maroon bags on campus. We have some more over there if you haven't gotten one yet, as well as some other goodies. Please help yourself on your way out. But make sure that that date is locked in your mind and your student has taken care of this before that date so you don't end up paying for 2 insurance coverages. This is very important. We want to make sure that your student has insurance, but they're not double covered unnecessarily, and that you're not paying twice. We'll get to questions at the very end. Just give me a couple of minutes, and then we'll be happy to get to that. Thank you. So, irrespective of whether your student is covered on the university plan or covered on your personal insurance, they have an option to pick up optional dental or vision coverage. And this year, we've expanded our options to include 2 separate providers, and in this case, 4 different dental plans that they can choose from and 2 different vision plans. And depending on what your students' needs are, we encourage them to explore these different plans if they have a need for dental coverage or vision coverage, and to look at these options, and then they can go directly online and enroll in the plan that might best serve their needs. So we have 2 providers, United Healthcare, who is the provider of the University Health Insurance Plan, as well as Delta Dental. And for dental coverage, Delta Dental and United Healthcare both offer 2 different dental plans. Delta Dental offers an HMO plan and a PPO plan. So the HMO plan has a somewhat more constricted network, and you need to get referrals, but one of the benefits there is that they have no maximum annual benefit in terms of the coverage they provide. But again, there's a few more constraints in terms of how you access your coverage. Their PPO plan has a range of benefits, but it does have a maximum annual benefit, and it provides a range of different services up through cleanings, fillings, oral surgery, and other types of coverage. United Healthcare offers 2 different plans that are a little differently structured. Again, they offer what they call a low plan, which is really a lower benefits range. So if your student has good, strong, healthy teeth, they're really looking at something that's going to provide them with cleanings. Maybe they might need a filling or 2, but really they don't have serious dental needs. This might be a good coverage plan for them. It's a much lower cost plan, but it's not going to provide any type of oral surgery or any more extreme services. The high plan is a little bit more comparable to Delta Dental's HMO and PPO plans in that it does provide coverage for oral surgery and more extensive dental needs. You can see some of those differences if you look at the different premium rates provided. Now, one other option that Delta Dental does provide is that you're able to enroll in the dental coverage for either a 6-month period or a 12-month period. And if you pick up the 6-month period, you can then pick up a second 6-month period for the second half of the year. Your premiums in that case will be slightly higher than if you paid for the 12-month period all at once. United, you do need to enroll in the 12-month period, and then you're enrolled for the full year. We have all of this information available on our website, so you don't need to worry about writing this down. But if you go to studenthealth.uchicago.edu and click on the Student Health Insurance tab, you'll find all of this information that's available on these slides. Similarly, for vision coverage, we offer a choice between 2 different plans. One is provided by Delta Dental, and yes, I understand it's a dental, but they do work with IMED in Illinois to provide a vision plan, and then United Healthcare also provides a vision plan. And again, these are somewhat similar, but they're structured a little bit differently, so we encourage you to explore the different options to see what might be a good fit for your particular student's needs. Both are vision PPO plans, so they provide you with a range of services and a range of providers that you can seek out. They both provide an annual vision exam with just a $10 copay, but then how they provide needs for glasses or contacts is structured a little bit differently. The Delta Dental plan provides for a certain bulk amount that you get covered. So for example, with eyeglasses, they will give you up to $100 for that cost, and then they give you a percentage towards the balance above that. With United Healthcare, it's structured as a copay system. So you want to look at, again, what your child's needs might be in terms of what services they're most likely to access and see what's going to be a better fit for your particular needs. And again, you can see there's a different range. Once again, Delta Dental offers you the option to pick up this coverage either on a 6-month basis or a 12-month basis. United Healthcare, again, it's an annual plan, and they're structured a little bit differently in terms of cost as far as what you may be looking for. So again, this information is accessible on our webpage. Both plans you can enroll in online, and we provide you with links directly to the provider pages. Also, you can access provider networks through our website as well as through the provider pages that are available through links on our webpage. At this point, I'm just going to turn it over to questions, and I'm going to bring Dr. Lickerman back up, and we're happy to answer questions related to dental and vision coverage, the insurance plan, the student health service, the student counseling service, and everything else we've talked about to you today. Thank you.
Thank you. Yes. You.
So the student health services, in relationship to the counseling and acute care and the whole or something like this, that is, like they don't have to be involved in UChicago in order to receive that.
So the question is, in order to receive, to use our services, whether student health service for acute care or even chronic care, some chronic medical condition, student counseling services, any of that, you don't have to be in UChicago to access those services. That's correct. The student health fee that your student is required to pay as part of their customary charges that they pay to attend school here gets them access to all those services. Students, however, are required to have secondary insurance, whether it is UChicago or being on their parents' policy, does not matter, but it is not that secondary insurance that gets them access to our services. Many, many students come to see us, and they get services from us that require them never to have to bill their insurance company. It's all covered by the student health fee.
So if they're referred out,
If they are referred out for either, say, a CT scan, certain lab tests, or to see a specialist, that is when the insurance will be billed. Yep. Yes. Right. So is the student life fee essentially include physical therapy? The answer is no. Physical therapy is billed to insurance companies with one exception. We do have what we call a movement specialist who works in the student health services who will help students with some basic issues. If they have problems with ergonomics, sitting at a desk, things like that, they will do that. But mostly physical therapy is billed to the insurance. Yes.
Could you explain confidentiality aspect and especially in cases
Yeah. Question is, how does confidentiality work and how do parents get notified? So if your student is over 18, we are subject to the HIPAA laws, which require us to, we cannot communicate with you about any medical condition or mental health issue your student may be experiencing without his or her permission. Most of the time, the students actually don't have problems doing that, but we usually encourage students to let us talk to parents, but if they say no, we can't. Now, the exceptions would be, for example, if a student is unconscious and in a life-threatening circumstance, we will contact parents. But the laws are very strict, and the students, obviously, most of the time want to know that we're following them. The University of Chicago faculty, so the deans of students, the resident heads and resident assistants, they're required to follow a different set of laws, something called FERPA. And my understanding is those laws are a little laxer and their abilities to contact students is different, but sometimes we're not actually able to divulge medical conditions to the faculty themselves, to the deans themselves. A lot of times they end up knowing through sources outside of the people who are actually delivering care, but the law is very clear in this area. We can't divulge it without the student's permission. I know back there, yeah.
So let me just get a little bit more information.
Can you repeat the question?
Were you completing paperwork for the athletics department?
Yes.
Then no.
Okay, I thought it was both, but yes, probably through the athletic department.
Right. The athletics department for very good reason, requires a pretty extensive packet of information because they are very committed to keeping our student athletes safe and healthy, but they require information separate for their own documentation. Students still need to complete our online waiver separately. And we try to help the athletics department make sure to publicize that to parents and students, which students sometimes don't fully understand.
I heard that you said that the vaccinations were available here on campus. Do you have any other vaccinations that are available to us?
Yeah, actually, any vaccination they might need is available to students. We have students in our campus travel all the time internationally, and we have what are actually called travel visits in the Student Health Service, so we can actually not only recommend, but actually administer the vaccines that they would need. Keep in mind, those appointments, we don't have a 24-hour service standard. This is a big issue because students often hold this to the last minute, and sometimes they need to take, it takes a month or so for the vaccines to take effect. So if they're planning to travel, we encourage them to make those appointments early. Yeah. Sorry? Oh, yeah, go ahead.
Yeah, we also have another service through Student Health. They're called immunization days, where it's just basically an open clinic, and you can come in. You don't need an appointment. It's from 10 until 3 on 2 different Saturdays. The first Saturday is October 5th, so that's the first Saturday after classes at the end of first week. And then the second Saturday is November 2nd. Depending on what immunizations they need, it sometimes is a series of immunizations, so they may want to come to the first one because they'll need another shot on the second series. So that's on our website. So if you go to any of the swag pieces over there, the chapstick, which by the way tastes very good, and the pen has our website on it, as well as the resource guide. Visit that and you'll have a plethora of information that will help you out.
Yes. The hospital does not provide dental services, unfortunately. We have, when students require dental services, we have, I think, a list in the community that we will try to steer them to, but we don't actually have our own dental services. Yes. Yep. So if a student gets a cold or a flu, we would encourage them to do what they would do if they have any acute medical condition, which is to call the Student Health Service and say that they're having a problem, and can we get them in to see them, and we will. Yes. Right. Right. So the question is, the Student Health Service, it's in the hospital, but it is an outpatient clinic. And the question is, what level of service can we provide students if they get really ill and require an inpatient admission? We're lucky to be we are at the University of Chicago, and so we have a world-class tertiary care inpatient hospital with specialists. And so, in fact, we do often, when students require admission to the hospital, we admit them here. And again, that's when their students' supplemental insurance would kick in. But if whatever they need, we do here. Anything from, IV antibiotics to surgery to bone marrow transplants, we do it here. That's in the hospital, separate from SHS? It is separate from, that is correct. So SHS is manned by providers who just see students, but if we utilize specialists in the outpatient setting or in the inpatient setting, we refer them to physicians in the hospital, which is separate from SHS. That's the same building? Same building, yes. Or I should say same set of buildings. There's more than one. Other questions I can answer? Yes?
As far as the insurance, with my daughter's going to be on our insurance, I noticed that there was no place for me to provide that information. So is it your responsibility or does the health service just figure that out if she ever needs it? You know what I mean?
Yeah. We do not have, so the question is, she's waiving the USHIP insurance and is going to be on, her daughter's going to be on her insurance, but there was no request for information about that insurance. We do not have what's called a hard waiver process where we verify that students have supplemental insurance. If they tell us on our website that they do, we believe them. But when you come to see us, we recommend that they bring their insurance cards and have that information available because you never know if we're going to need to bill them. Sometimes, for example, if we recommend a series of tests, the students want to know how much will this cost me. And the only way to know is for our coordinators to call your insurance company, and we will facilitate that and help them figure it out. But obviously, your daughter has to have that information with her. Go ahead. Yep, add to it.
Well, and ideally, your child would have had that insurance information in order to do the online waiver, because she would have had to enter that information But we also encourage her to have that insurance information with her if she needs to see any follow-up specialist or for any care, because otherwise what will happen is you'll get billed directly, and then you'll have to follow up with your insurance, with your insurance company to then file that claim. And it's generally more complicated to do that after the fact than if she just provides her insurance information at the time.
Yes. Sure. You need to talk with your insurance company to verify what benefits are available in the Chicago area and find out if the University of Chicago is included as providers so that they can come see us. If they, regardless of whether that is the case or not, they can always come to see us for the initial appointment because the insurance has nothing to do with that appointment. It's the student life fee that they've already paid for. If then we need to refer them out to doctors, if it turns out the insurance limits who we can send them to, we will obviously work with the insurance or we will refer them where you or the student tells us their insurance company will cover them. Yes? Yeah. Yes.
Is that at a rate as if the student had prescription insurance, or does the student have own prescription insurance there?
Yeah, so that would be covered by their insurance.
By the prescription insurance?
Yes.
Let me stick in another one. On the subject of mental health, was mentioned the ASAP program.
Yes.
Helping students, they know that it does better than I do. We're less critical, just, okay, I'm in college, I would have my time, how do I study? Are there less critical programs for that on campus?
Yeah, no, so the question is if the student is just struggling with time management and less critical study issues, the answer is, yeah, the criticality of that is a subjective thing. So the program, the ASAP program, may still be appropriate. If the student calls the counseling center and describes their need, we can find a resource for them. Sure. Yes. Right, no, it's separate, so I'll let Marcy.
Yes, the dental plans, the dental and vision plans are optional plans. So irrespective of whether you're on the university insurance or private insurance, these are optional plans that you would enroll in separately. Yes.
It is not included.
No, not included.
Sure. Other questions? Okay. Yes. Okay. We have ENT physicians who could handle that. So the question is, her daughter has a cochlear implant and needs regular programming, or is there a facility nearby that handles that? Yes, the University of Chicago, we have ENT physicians who would be able to handle that. So what she should do is probably either one, if your insurance allows her to see a specialist without a primary care physician referral, she can just contact the ENT clinic and set up an appointment. Alternatively, if she wants to come in to meet us in the student health service, we can arrange that appointment for her there. Sure. Yes. So most of the student life fee goes to healthcare services with us. There are some non-healthcare services. I don't actually know the answer to what they cover specifically. It's something you could look on the university website to find. But for us, it covers unlimited free access to student health service, student counseling service, and then programming from health promotion and wellness. Sorry, I didn't hear that. So the idea is that it is sort of the university's own HMO. By paying that student health fee, you get basic services. So all visits themselves are covered. There's in the student health service some basic lab testing we subsidize as well. That's also covered. The student insurance, or either the university insurance or your insurance on which your student is still covered, covers things like supplemental lab testing, x-rays, inpatient admissions, referrals to subspecialists, things like that. So most students, I think, most of the time, if they have a medical need, we can handle it in the student health service or student counseling service, and the insurance never gets billed. Yes? You mean the web address? Do you know the web address for the? She wants the web address for where she can do the waiver online.
It's on the web. Yeah. The web address for the online waiver site is studentinsurance.uchicago.edu.
Any other questions that I can answer for you? Okay. Oh, yep, back there. Immunization forms you can turn at the Student Health Service. Nope. Okay, thank you so much for your time and attention. I appreciate it.